This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch. Featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
On a Super Sunday, well, it's always a Super Sunday when we're here, right?
Oh, John, okay. John, you're too good to me.
On a Super Sunday, it's another edition of Health Watch here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We discuss on this program the who, what, when, where, why, and how of Innovative Medical Associates, how they can help you improve your overall quality of life, you and your family, and many questions answered during the course of the program. 855-839-1210 is the number here in the studio. 855-839-1210. If you have any questions for Dr. Molly or you have a medical challenge you want to run by her, this is the time to do it. 855-839-1210 is the number. And we would ask Dr. Molly who she's rooting for, but I don't think she really knows. You don't know who you're rooting for.
No, you know what, John? I know some of the deal, the Kelseys and, of course, Andy Reid and all of that. But, Dr. Molly doesn't have really time to spend in front of the TV today.
Right.
So,
You're rooting for Taylor Swift, right?
Yeah, okay, Taylor Swift. That's good. I know she's had a she's a big phenomenon. What can I say? Yeah. I wish people would pay so much attention to their health.
Right,
okay?
As they do with this stuff.
I agree.
Speaking of health, what is it that you? We do this every week. What is it that you do, and what is it that's different from everybody else?
Sure. Well, one of the things I want to say is, look, innovative medicine is just a group of like-minded healthcare providers who work from my licensed facility in New Jersey, in Marlton. And we are a primary care facility, and that means we can do anything that a normal GP would do for you. If you need radiology, we send you out for x-rays. If you need blood work, we actually have one of the labs right on site, as well as being able to draw the bloods, et cetera, right from the office. So these are the things. And, of course, if you need a pharmaceutical, my wonderful physicians can order a pharmaceutical for you. But really what sets us apart, John, is the philosophy of Innovative Medical Associates. What we like to do is use the least amount of a pharmaceutical medication to help you through your medical challenge without putting you at harm's risk. And we do that by using natural substances like vitamins, minerals, amino acids, herbals even, that are readily available and that we know scientifically, I want people to understand, I've scientifically looked at this, get the constituents that you need in a therapeutic dose that can help you possibly reduce your need for the medication.
One of your patients the other day was asking a question, and she was just asking it in general to whoever was sitting there. She said, and I didn't want to answer, but I kind of knew the answer. She said, are there any side effects to this? And I said, hardly any ever. I mean,
sure.
I've never had any.
Sure.
So talk about side effects.
Sure. Of course, if you take the wrong combination of natural substance, you might do yourself a little harm. And if you have an allergy to something, you want to know that, because an ingredient may be in the natural substance that might cause your allergies to act up. But overall, I think in 27 years, particularly with the powders that I secure, has been that we really haven't had any side effects. Maybe some low blood sugar or some changes, where somebody works themselves up a little bit and, they feel a little faint, that kind of thing. But again, we're fully staffed. We have everything in place. We have everything in place that you would need for a medical emergency.
How many treatments would you expect to get started? Speaking of the patient who gets started.
Here's the deal. most people can start to see changes in their quality of life depending on what they're coming to me and where they are in their own continuum of illness or condition. This is a big problem, John. You come into me at stage 4 cancer, obviously 5 treatments isn't going to do it. But you come in and you want some longevity work, or you have a little bit of a high cholesterol or some variation of that. We start to see improvement in 5 weeks. But fundamentally, it's going to take between 5 and 30 weeks to really do a course of treatment.
Do you have a maintenance, like after they've achieved
sure.
their goal?
Yeah. You know it.
Yeah.
You come in twice a week. I think you come in twice a week because, unfortunately, you're one of my guys that has several challenges.
Yes.
So we can only hit one at one time and one at another time. I mean, you got to look at that. And what we do is we certainly put the maintenance out. I'm a big believer that a patient knows their body. And so some of my patients come in once a week, some of my patients come in twice a month, some of them come in once a month, and some of them come in once every other month. And, do we say that that's good or bad? Well, I want you to be aware of your numbers, how you're feeling, and I never want you to go back to the state you were in when you came to me. There's the issue, right?
Yes. That same patient who said, are there any side effects? She then said to me, well, how long you been coming here? I like this question. I said, 20 years. Wow. Well, I guess it works.
Or they think we're nuts,
Right.
But that's okay. Look, bottom line, the proof of this is in how our patients feel. The qualitative data many times is as important as the quantitative data. In other words, if you see a reduction in the lipids, if you see a reduction in the inflammation markers, then we know we're doing our job. But more importantly, I want to hear, hey, listen, I was able to go to Hershey Park with my grandkid this week, and it was something I didn't think I could do. I was able to walk to the pool with my grandchildren, or my nieces and nephews, or my kids. Guess what? That's a big win for me.
Yes. In general, what has worked best as far as your treatments are concerned? By that I mean, is it a heart condition? Is it a
that is
other
such
types
a
of
loaded condition. I cut my teeth on chelation. Everybody knows that back in 20 years ago. And that, of course, worked for reducing the lipids and also increasing cardiac output because of our cardiac protocols. But I have worked with people with autoimmune, and we have been able to help them improve their quality of life and reduce pain. I think my most challenge is the cancer patients, and they're my hardest challenge because many times they come to us when they're pretty far in their own cancer treatments, and they've also have all the fear that, oh my God, if I do this, am I going to interfere with my cancer patient? And what's my oncologist going to think? And all of those kinds of things. So they are a difficult patients in that we have to really look at their particular case and say, okay, this is the particular protocol I'm going to use for them. I find it interesting because I have a long-standing patient, Pat, who's a cancer patient, and she just faxed me this week all of her results, not only her blood results, but her CAT scan. And indeed, there was improvement and stabilization. I have another patient. She faxed me this and says, look how stable my numbers are, and look how stable the tumor is, and the one on my liver has gone away. And so for me, that's a win. Does it mean she's cured of cancer? No, but it tells me that somehow what we're doing in addition to the conventional treatments is maintaining her stamina through her traditional treatments, and she's able to finish a course of the traditional treatment.
So the cancer patients are more difficult, obviously.
Yes.
How do you navigate that?
Well, you want to look at their results. You want to talk to them. I talk to everybody week to week, as you know, and I get some data, and that's really the key. We have to see where we meet a patient where they are, and I want to continue to meet the patient where they are in the continuum. And, look, we advocate for our patients the best we can, meaning my physicians, myself. I mean, we review the charts. We look at the blood work when they send it in. I look at the CTs, etc., and we sit down and have a staff meeting about it, the medical and myself, and we say, okay, this patient's doing well. Maybe we want to change up one of the anti-inflammatories or something. But all of that is an ongoing thing, John. Bottom line is, I ask my patient, how you feeling? How you feeling?
And in general,
they say I'm not doing so well or I'm doing well, and then we tweak things and we see how they're doing the following week.
So again, it is an ongoing
It's
process.
Hey, listen, this is always in process. Don't think that when you have cancer, you even in your traditional treatment, you're in process, no matter what, John.
And do you find that it's helped them as far as their immune system is concerned?
Well, that's another whole issue, and indeed, we're going to talk a lot about that this
later on in the show. Yeah,
yes.
we're talking about that.
What we want to try to do is we want to try to keep their immune system in balance. I think there's and we'll talk about that, but I do think the idea is you've got to realize these the traditional treatments can take a whole lot out of you, and they do, no matter what. They do. And so the idea is I want to help you live through your traditional treatments.
Yeah, I have a friend who is going through it now, and he said, boy, every 3 weeks he gets a treatment.
That's right.
And he said, boy, it really knocks me out.
That's right. And I have many patients on that schedule who actually say they come in to see us afterwards. And boy, do they do the best during that time.
Yes. We are coming up on our first break of the morning. Our program is called Health Watch. And you'll find us here every Sunday from 8 until 9 on Talk Radio 1210 WPHT. I'm John DeMasi with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. You have a question for Dr. Molly or a medical challenge? We tell you this every week at this time. We always get calls at the end of the show, and we try to get them in real fast. 855-839-1210 is the number. We have plenty of time to answer your questions or your medical challenge. 855-839-1210. We are both returning with more of today's edition of Health Watch right after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates while we are here on the radio, and of course they will be there after we leave you today at 9 o'clock. And the number, 856-489-0505. Again, 856-489-0505. When you call, there's only one thing really you should do, and that is set up your initial consultation with Dr. Molly. It is complimentary, doesn't cost you anything, and you will find out a lot about what she does, how she can maybe help you in your journey as far as overall health is concerned. So that's what you really want to do. 856-489-0505 is the number. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to the phones right now, talking to Bob in Ben Salem. Bob, good morning. Welcome to Talk with Health Watch.
Hey, Bob.
Oh, thank you. Hey, good morning, Molly, Dr. Molly, and John. I just have some comments which are cumulative over the last few shows, and I think one of the things that Dr. Molly never mentions is how important it is to have some kind of knowledge of, or at least have some thoughts about it, is the chemistry today. And what I'm getting at is when I was in college, after I got out of the military, one of the courses I took was a nutrition course, which was rather new, with Dr. Yurkevich, and he emphasized reading labels, and that's all we do is read labels when we go into a store.
God bless you.
And the thing that really blows my mind is when I see these people with a cart that's loaded up, and they have no idea how many chemicals they're getting, nitrates, all kinds of junk. Mm-hmm. And then they wonder why they get cancer. But anyway.
Yeah. Thank you, Bob. That was a great comment, and it is true, because we all know that all of these things do what? Cause inflammation, and inflammation is the biggie, right? When inflammation gets out of control, man, you got a problem. And I can't agree with you more. And, Bob, I don't even know today thank God for guys like you. And I do read labels, and I know what goes on here. But, I think it's even more than reading the labels. You know what's happened to us? We've become fast food crazies. In other words, we have these meal kits sent to our house. We use the microwave ovens, and it's even more than reading the labels. It's just how we live today because it's all so fast paced. Nobody's back in the kitchen. Back in the old days, I remember my grandma spending 3 hours making a red Italian gravy, so to speak, or sauce, however you want to call it. But today, forget about it. It's just not going to happen. And I think John and I know that for the most part, most people just don't have the time. We're so busy doing what we do to eke out our livings, right?
Yeah.
God bless you.
Well, you have to make time, and when you start making time to do these various things, like going to your clinic, then it becomes a habit.
Yes,
So
you're right.
That's right.
It's really not a bother anymore because it's just part of your life.
That's right.
Well,
That's right.
I appreciate your call, Bob, because now I know which Bob you are. So, I appreciate your call, and I know that I only wish you and your wife both good health.
Bob,
And
thanks for the call.
Thank you.
We
That was a
appreciate it.
wonderful call. Thank you.
You taught me
Bob's
way
a
back.
lifer.
Yeah,
Bob's a lifer, actually.
You taught me way back when to look at labels, and I looked at labels on soups, canned soups.
Oh, my God.
And you told me never again buy a canned soup.
Well, don't get Campbell's mad at me, will you?
Okay.
No, I know.
I didn't say the name. You said the name.
Yeah, but I don't want you to get anybody mad at us over this.
yeah,
but
but-
look, if you do it once in a while, that's one thing. But I think, unfortunately, we're all stuck with this. And we've got to start, looking beyond that. Today, there's so much fast food. Even when we prepare it at home, it's fast food.
That's
These
right.
meal kits are fast food.
That's right. 855-839-1210 is the number here in the studio if you have a question or you want to run a medical challenge by Dr. Molly. We're going to talk about autoimmune disorders today.
Yes, we are. John, I want to end that segment, though, with something. Would you ever think your mother, and I knew your mother, would ever put a TV dinner in?
No.
That's right. We
never.
come from a long line of folks that would
Old
never
school
do.
Italian.
Old school, all right. But you're right. We're talking about
never got a TV.
No, neither did I.
And I
Come
didn't know
on.
what that was.
Nobody
when
did.
the craze was, and I was over a friend of mine's house.
There you go. This is a
and
good thing.
She said, "Well, this is a TV dinner."
Yeah,
and I
good
said,
luck.
What was that? I said, "What was that?"
That was like eating poison, okay? Right? I tell you, right now my mother's turning over, so
Yeah.
I think yours would
Yeah,
be too.
yeah,
God bless them.
that's right.
Anyway, autoimmune disorders. Okay, one of the things I want to talk about is autoimmune disorders because there are over 100 of them at least. So the immune system protects the body from diseases and infections brought on by the viruses, external factors, right? Germs, bacteria, abnormal cells. But when the immune disorders develops, what happens? The immune system mistakenly goes after your own organs and tissues, all right? The thing that's fascinating about these autoimmune disorders is, again, there's over 100 of them. So they can affect the skin, they can affect the digestive system, they can affect the hormones. Little people don't think about that. They can affect your neurotransmitters. They can affect all kinds of things. But what do they all have in common, John? What do you think?
Inflammation.
Amen. Inflammation. So when we look at things that come into our clinic, and I'm just going to talk about some of them that we have treated here. You look at scleroderma. I've seen scleroderma be mild. I've seen it go undiagnosed, like someone has a touch of scleroderma. You have a touch of an autoimmune disease, you got a problem, okay? And, we've seen the Raynaud's that develops from that, the cold hands, the lack of blood flow to the extremities, these kinds of things. Lupus and sojourns can come from this kind of thing, from the skin disorders, the digestive disorders. Man, I have cut our teeth now on these digestive disorders. You look at all this. People come into me and they're celiac. They don't believe celiac is an autoimmune disorder. Oh, I'm gluten-free. Well, why are you gluten-free? You have a sensitivity of some kind to the gluten. So you have an autoimmune disorder, mild or much more severe. And what can happen? IBS. And so that has pain. You have ulcerative colitis. We have treated more ulcerative colitis with a subclinical dose along with an anti-inflammatory protocol. It'll knock your socks off. In fact, John, you're there lots of times when you see many of my patients who come in with the digestive problem and have run the gamut of the GI deals.
Yes.
Okay,
Yes.
right? Well, Tuesday's a big day
That's
for
right.
that. Hormonal disorders. People think, okay, there are not many hormonal disorders that can be autoimmune. You're wrong. Type 1 diabetes attacks, and generally that's one of the ones that people are born with, hereditary kind of thing, or not. But it attacks the pancreas, and what happens? It screws up your insulin. You screw up your insulin, you got big problems with diabetes. Now, Graves' disease, thyroid is overactive. I have people come in and say, well, I have Graves' disease. Okay, do you know that's an autoimmune disorder? No, Dr. Molly, the endocrine never told me that. Well, it is. It's an autoimmune disease. So how do we treat it? Of course, you may have surgery, all kinds of problems. Hashimoto's. How about the Hashimoto's disease? Is that immune activity? Yes. You've got to start thinking about all of these conditions in a way that also goes back to the culprit, which is inflammation and inflammation markers.
So you have to eliminate the inflammation.
Right. Or you have to really, and I'm not saying to throw out, for example, I don't tell you to throw out your thyroid medication, but we need to then tune up some of these other intricate markers, interleukins, cytokines, you've heard me speak about this, that react. And what we need to do is hold down the inflammation and maintain your health through this. And it's a big problem. The neurodegenerative diseases, they blow me away because my own medical director has MS, right? It's a scary thought because you talk about having a problem where your functionality is impaired. All the neurodegenerative diseases do this, whether it's MS, whether it's PSP, like the woman that I had a while ago, whether it's MSA. I'm having a patient come in from New York. I spoke about that last week, possibly with the MSA, and other diseases. We've got to look at their particular interleukins, their particular cytokines, their particular growth factors. And from that, I have to look and say, okay, which cytokines, what particular growth factors are affected by what particular supplements? What can we do to hold these down?
It seems to me that there are too many of these autoimmune disorders.
Plenty.
And so how do you navigate
that's the problem?
Right?
Therein lies the rub. It is not an easy thing. Some people present with very mild symptoms, and you think, oh, it's not an autoimmune disease. Oh, you have a little skin condition. Well, guess what? If you have a skin condition, as I said earlier, you may have an autoimmune disorder. So how do you treat it? One of the things we do is we look at what particular interleukins are affected. We know IL-10 is one of them, but we want to know which other ones are affected and how do we calm them down. There's the answer. You're looking always at what are the particular analytes that we need to focus in on, and there are anti-inflammatories that do just that. For example, also using what? You know, I'm a big proponent of LDN and low dose. And we believe in tincture, because guaranteed you can't take what is low dose. It's such a small dose. How do you get it in capsule? Not a good idea.
We are at the halfway point of the show, and that means we have more Health Watch on the way. 855-839-1210 is the number here in the studio. 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We are both returning with more of today's edition of Health Watch right after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and the number 856-489-0505. Again, 856-489-0505. You call, you make your appointment with Dr. Molly for the initial consultation, and you'll be on your way. 856-489-0505, and the website InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. Health Watch every Sunday, 8 till 9 here at Talk Radio 1210 WPHT. One of our favorite callers is with us, Frank in the Northeast. Frank, good morning. Welcome to Health Watch.
Hi, Frank.
Good morning, guys. Sorry, guys and gentlemen. I mean, lady, I messed that one up, too. Dr. Molly, I've known you for a long time. I consider myself a good friend of yours. That is why I'm giving you ample time to order the confetti, the balloons, the trumpet players. I have an appointment to see you next Tuesday, February 20th at 11 a.m. So
Good. Good, Frank. Good.
But don't
good.
call out sick. And is John going to be there next Tuesday?
No.
Oh, yes. I'll be there with bells on, Frank.
Yeah, I'm glad you
Will
have
you
an
be there,
appointment.
John?
Yeah, of course
I will.
he will.
Yeah.
What time are you coming in, Frank?
11 a.m. on the 20th
Oh, that's
next
perfect.
Tuesday.
That's John.
Yeah.
John's there at 11. No worries. Yeah.
And Dr. Molly, what Bob from Ben Salem said about the food,
Yeah.
we had a great dinner every night. Mom did a great job cooking. Dad sometimes. My father's Cuban. My mom's all Irish. But every Sunday, we had Italian. I don't know where that came from. We had Italian. That was always our tradition. Italian Sunday every time. It was great. Anyway, I'm looking forward to meeting you. Not meeting you. I've seen you before.
Yes.
To seeing you again next Tuesday, February 20th, 11 a.m. I can't wait, Dr. Molly.
Thank you. And we can't wait to see you, Frank. I know Barbara's very interested in all your regiment, so we're going to help you the best way we can.
I can't wait to meet John. I missed him last time I was
All
down
right,
there.
honey.
Okay.
God bless.
Have a good one. Bye-bye.
I'll see you then. Thank you, Frank. Thanks for the call. 855-839-1210 is our number here in the studio. We're picking up the discussion about inflammation
And autoimmune. So one of the things, John, we talk about is why do these things occur, right? Everybody talks about genetics. And just because your genetics say you could be prone to an autoimmune disorder, somebody in your family had maybe Graves' disease or thyroid problems or something, do you have to be prone to that? No. Or one person told me once, listen, they still had a history of thyroid problems, autoimmune, but they got MS. Well, just because you have a history of something doesn't mean you have to have it. This is where the food labels come in. You've got to watch and follow an anti-inflammatory diet. You've got to watch all of those things. So genetics can play a part, but it's not the whole part. Hormonal status can play a part. One of the things that we found the connection is estrogens may have something to do with some autoimmune disorders. One of the things you think about is estrogens with breast cancer, right? And if you subscribe to the school of thought that we do, our philosophy is cancer can be an autoimmune condition. It's inflammatory. So there's something. Exposures to toxic materials. How's about all of the things we have, that all the sprays, everybody knows about some of the problems with our food supply and what is used on the food to grow the stuff. How about all the stuff we breathe in? How about heavy metal toxicity? That's something else we really need to look at, because we've seen patients who come in and they don't even know that they may have a problem with mercury. And in the case this past week, I have a patient that has a high lead level. They don't know where they got it, and I don't know where they got it. They weren't exposed, but they definitely did. And I'm not talking about something in the hundreds, but even something that is 20 points above what is the regular range can then cause an inflammatory process, even if it's low level. Think about having that over the period of time. That then can cause an autoimmune response. So there are many things, and toxic exposures, that goes without saying. We all have the pollution in the air, and smoking. John, I go to you. Smoking, I believe, secondhand smoke contributed to your first particular bout with that dastardly disease.
Yeah, that was really something. In fact, a friend of mine is an oncologist, and he said, when did you stop smoking? I said, I never did.
That's right. That's
so,
right.
So, I mean, I guess it was secondhand smoke.
Sure. And if you think about the kind of work you did, you had to go, a lot of guys in advertising were smoking through meetings and everything because they rep the cigarette companies. Come on. You know it and I know it. And radio is notorious for that.
Right.
So here you go. Now, the question is, how do we manage this? Well, we manage this with particular protocols for the particular challenge. You'll hear me talk about when I'm looking at neurodegenerative diseases, I look at things like the neuroamino acids. I look at things as peptides. There are certain peptides that can help a patient. When I look at the skin disorder, everyone knows about collagen as a peptide. We deliver these things through the hydration. And why do I use the hydration? Because I can extract the natural ingredient that we know has the effect on the particular markers that I'm looking at in their particular blood profile.
Is chelation a part of this?
Oh, chelation is definitely a part of this. If you see people who have high lead levels, high calcium levels, they may need to have a course of chelation, even before we start some specific protocols for their specific conditions.
It's, again, a real challenge
that
you're faced with.
It can be a real challenge on the ongoing. It's like I have a wonderful patient. Everybody knows him. He's my barber friend who comes in, and he has a skin disorder. And I'm fairly confident that it started from a medication that started him to have an inflammatory process, and he was smart enough to know this. So what do we have to do? We have to hit him with an anti-inflammatory that may include something called a licorice extract, and I did do that, and hopefully it's helping him. But this is a long haul because there's other things to consider. Age, John. The older we are, the less likely, if our immune system isn't working, it takes a little longer for me to get it back to homeostasis or the balance. And you know, I believe in Goldilocks. Not too much, not too little. And therein lies the rub with all of these autoimmune disorders.
And with these disorders, it is a challenge.
Yes.
But are they patients of yours forever? I mean, what is the situation?
I can tell you that they're patients of mine for quite a while. And it would be a lie to tell somebody you're coming in and I'm splashing the holy water on you and you're walking out a new person. Look, usually I find that when people have a weakened immunity, right, a weakened immunity and they're in overdrive, they tend to have a lot more challenges than just the one that presented to me. They have other things that are more occult or hidden, and therein also lies the rub, because we have to ferret all of that out in order to get the patient back to homeostasis.
How do you find that?
Usually you find that by talking to the patient, getting a good history of when this occurred. In the case of cancer patients, I need to get a little bit more of not only the family history, but something of what they work, this kind of thing. And then we've got to look at certain particular blood markers like interleukins and cytokines that immunologists have looked for years, but are not normally done as routine blood work.
Now you're a detective.
Exactly.
In addition to a PhD doctor.
And I will tell you something. I think most physicians, although we don't always talk about it, really have to take that tack. It's easy to come in and say, I have a skin condition, and it's easy to walk out with a prednisone type of cream, right? But I think the problem is today, they don't have the time to do the detective work all the time that they need. But when they do, they really come up with what is really going on. And then it's a question of trial and error. But in the end, John, it's always an inflammatory process.
And with that, we are coming up on our final break of the morning, which means you still have time to jump in here with a question or a medical challenge for Dr. Molly. 855-839-1210 is our number here in the studio. 855-839-1210 with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. I'm your host, John DeMasi. We are both coming back with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators standing by at Innovative Medical Associates, and they will be there well after we leave you at 9 o'clock. In fact, they're not probably watching the Super Bowl. They're answering your calls. 856-489-0505, 855-489-0505. That's the number. And remember, the initial consultation with Dr. Molly is complimentary, and you can really find out a lot about your condition and about how she can help you. 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A couple of minutes left of the program, and if you have a question or a medical challenge you want to run by Dr. Molly, you can call here in the studio, 855-839-1210. We want to kind of finish up on the cancer and the autoimmune.
Yeah. John, one of the things I want to say is tell the people, look at your go on the web, look at PubMed, and you'll see that there's been a link established between autoimmune. There's tons of documentation showing that it's been established that there are links between certain autoimmune cancers, certain autoimmune diseases and certain cancers, in particular things like Sjögren's and those kinds of things. But what's happening is because now we're doing more and more molecular and genetics studies, we're finding more and more a particular genetic links in terms of the cancer tumors to things that are also readily in the blood work, etc., of people who have certain autoimmune disorders. So, of course, there's more data that has to be put together, but I would say absolutely you're seeing more and more natural physicians, naturopathics, and people who believe in functional medicine, that there is a tremendous link between cancer and autoimmune.
Okay, we're going to talk about some of the patients,
sure.
And you got a lot of out-of-town patients.
Yes, I still do, and I have a new group that has come in this week. So, the young man that I've been treating, he's like 35, 36. I've been treating him for a particular bacterial infection that actually was pretty terrible, and I believe that we sent him out for all kinds of traditional testing. That's one of the beauties of what we do. Again, not being a spa, we're able to send people out for medical testing like CTs, echoes, this kind of thing, and we found that this guy really does have this bacteria that is unique to the region in which he comes. We don't see it here in New Jersey. So when we ordered the blood cultures, we had to look at the area and see what type of bacteria might be readily prominent in that area. And so in doing that, I was able to say to the doctor, look at this. These people are farmers. I want you to see this particular outbreak in this particular area. And, of course, Dr. Pat said, damn, Mama, you're on it. That's she goes, I didn't even know that. She said, I don't think I heard of this since medical school. And lo and behold, his culture came back positive. We're able to treat him with traditional medication through hydration. This is a traditional function of medical hydration. And then also keep him feeling better through this treatment because he was pretty depleted. You can imagine he must have had this bacteria for at least 6 months.
Back to being a detective.
Well,
how did you find that out, though?
Well, I started to put together some of the symptoms and this kind of thing, and I thought, there's got to be something. This is not in this boy's head. It's not in his head. Now the question is, you've got to really look at the CDC. You got to take the time to spend the time on a particular patient, and every patient is unique, John. Every patient is unique. I don't need to run down the CDC website for most of my patients because they're here in the Philadelphia area. Maybe I have to run down some other things, but not the CDC stuff, right? But it's an interesting thing because I never know who's walking into my facility and what kind of work my physicians and I have to do to really help that patient improve their quality of life.
I'm curious, where was he from?
Indiana.
Oh.
Indiana.
So this is not around.
No,
it's
definitely not. And I actually had to alert the lab because they wanted to know why we were testing for this. Generally, that isn't done except in the Midwest. And I have another patient from Ohio that had a particular type of challenge also. So it's the entire Ohio Valley that is susceptible to this particular condition.
And any updates on other patients?
Yes, I have a wonderful young man who's in his 30s who's doing traditional treatment at a very well-known institution in Philadelphia. And initially he came in to me a wreck because he wasn't sure he'd be able to continue doing the traditional treatments, but he's found that after 4 weeks, he seems to be doing better and doing well with his traditional treatment. And therein is something that I believe in. Don't throw the baby out with the bathwater. If we can help you, it's how you put your anti-inflammatories together, how you use the vitamin C in a pro-oxidant manner, and what you put in with is the synergies of these things to help a patient through their chemotherapy.
So how are you doing that with this patient?
With this patient, I'm using a particular form of vitamin C and additional homeopathics to enhance the pro-oxidant effect of the vitamin C.
There's my old friend, vitamin C again.
Absolutely, absolutely. It's very highly anti-inflammatory.
Any other updates on patients?
And, of course, I have a patient who's coming in with neurodegenerative diseases this week that I think we're going to be able to help, and we need to use a particular amino acid for this particular person that we don't always think of using in neurodegenerative diseases. But glutathione is very, very important for the liver, but it's also important for the brain. So glutathione and the particular form of glutathione along with certain other things and certain B vitamins. And again, I go back to this. Again, we need to look at the patient's own blood work and say, can this patient really utilize the vitamin B in the form that is traditionally given, or do we have to use a different form because they suffer from a genetic dysregulation that won't allow them to use B12?
So glutathione helps the liver and the brain?
Yes, absolutely.
I didn't know that.
Yeah,
I didn't know that.
It's very important. It's a very important amino acid, along with alpha-lipoic and several other things that we might use in this. The other thing we have to do is we have to maintain the lymphatic system for all of our cancer patients. Why? Because all of our white blood cells and a lot of the things are located in the lymphatic system. So it's important to continue to have the lymphatic system be tuned up, and we do that with homeopathic remedies as well as things like herbal remedies that can be utilized in medical hydration if utilized properly.
No wonder you have 2 PhDs.
No, I don't think
I mean, the wheels are always turning.
Yeah, I do spend a lot of time, which is
know
why
that.
I can't watch the Super Bowl tonight. Okay,
You'll be studying patients, that's for
right,
sure.
That's right.
And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, the operators are standing by right now. They'll be there well after we leave you at 9 o'clock. 856-489-0505. That's the number, 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. And, of course, there's Joanne, Delightful D, Fabulous Fran, who makes a great cup of coffee, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, 8 till 9, Health Watch, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.